seek agreement agenda items 4 and 6 are recorded by Hansard. Agreed. Any apologies? Apologies. Draft minutes, pages 5 to 10. Members content their record?
Yes.
Agreed. Require members summary table requests for information, pages 12 to 14. That's for noting only. Flexible working inquiry, briefing from the NIE. Can refer members to the presentation slide of background, pages 16 to 28 of your packs. Okay, members, can I welcome to the meeting Mr. Ken Moran, Board Member of Momentum NI, Mr. John Martin, Project Manager of Total Mobile, and Mr. Ronnie Geddes, Sales Director of Total Mobile. You're all very welcome to the committee. Do you perhaps want to take us through the presentation you've provided for the committee?
Indeed.
We'll move to questions.
Good morning. Thank you for inviting us to the committee. My name is Ken Moran. I'm a Board Member of Momentum. And for those of you that don't know Momentum, we are the non-profit organisation in Northern Ireland, specifically in the IT and digital sector, with a specific focus on small and medium enterprises. So our remit is to try and grow the indigenous information technology sector in Northern Ireland by providing them with access to markets, to funding and to other initiatives to basically help them grow. In terms then of the discussion around mobile working, I guess, there are pros and cons to mobile working. We're going to look at a case study, but if you look at some of the advantages of mobile working, which have all been available in the private sector for the last 10, 15 years, it's very clear that there is not a technology blocker here in terms of looking at flexible and mobile working in the public sector, because all the technologies that are needed to facilitate this are all well proven and well established. There is, however, likely to be a cultural issue in terms of mobile working. When our company introduced mobile working, for example, the initial blockers to that were, would people actually work from home? Would people actually work remotely? What happens if they're not in the office and they can't be managed face to face? But if you look at some of the advantages in terms of things like an improved work-life balance, so if, for example, a young parent in the public sector has an emergency with their child, are they going to have to take the day off to basically look after that child? Is that going to increase absenteeism? Do they have the ability to basically take 2 hours out and then work from home? So it's all about trying to provide the technologies to allow people to have a better work-life balance. Also the ability to retain key staff, and I think we're going to see this changing, because as younger people come into the public service, they are going to be more familiar with the flexible and mobile working that they use personally, including things like social media. So as this as this age changes, I suspect we're going to see more demand for more flexible working from new entrants into the public service. That leads also onto the attraction of better candidates. I mean, if the organisation isn't able to provide the technologies and the tools to allow people to implement their preferred work-life balance, you're not going to attract those people into the public service. They're going to go somewhere else where they can actually achieve that work-life balance. Some of the issues in terms of the mobile working is communication strategy. As I said at the start, the perception could be that if you give people mobile working, that they're not going to work. That's obviously completely not the case. I personally am a mobile worker. I work for a company in Maidenhead. I have a home office. I find that I actually work more at home. I work when I want at home. I start earlier. I can take a break. I can work later. So it's all about, again, providing the flexibility for people to do the work at the time that they need to do it best. I would suggest a key issue or a key concern from the public sector's perspective is data security. However, again, I stress that the technologies and tools exist to basically cover that. There are private sector organisations, obviously working in areas like defence, who would have highly sensitive data. So even though they may not be private sector, there will be organisations who are deploying technologies that are capable of protecting and managing data all the way through confidential, secret, etc. So I think data security, bluntly, is a bit of what's the phrase? The red herring. It's not a real issue. Obviously, another issue to look at is training in terms of how do we ensure that the people who are using these mobile technologies are exploiting them properly, and obviously the currency of equipment in terms of mobile devices such as Blackberries, iPads, smartphones, desktops. But fundamentally, this is all about people. This is not about technology. There is nothing to stop the public sector today implementing remote working and flexible working for their staff that will cover off the data security requirements and the performance requirements. This is very much a cultural piece and a change management and personnel management piece. And unfortunately, we've had a bit of a last-minute cancellation, so I'm not going to talk through this piece here. The committee have the slides. We will take, obviously, questions on this at a later date, but unfortunately the chap that was due to present this, Fergus Sweeney, has had a last-minute cancellation, so apologies to the committee for that. I'm now going to go on and we're going to introduce a case study that will show you what could this look like in real life. So not a hypothetical or a theoretical discussion, but very much what would mobile working look like in healthcare, for example. I'm going to introduce John Martin, who's the Business Development Manager from Total Mobile.
Okay.
Do you want to switch so you can play?
Okay.
Excuse me.
Good morning, everyone.
Morning.
My role in the company is one of managing our partners who actually resell our technology, and this is technology that's actually developed here in Belfast. A vast majority of our business is actually exported out of Northern Ireland, over 90%. And companies like Capita, Civica, Vodafone, BT resell our solutions and our technology and software, so we're certainly recognised as leading in the market. So in terms of Total Mobile, we're active in both local government but also healthcare, and we have taken the area of healthcare to use as an example this morning. So really our solution, it's been alluded to before, but it runs on iPads, Windows, tablets, smartphones and so on across a range of devices. Again, not a one-trick pony. Some people only bring out applications that run on one device. Our solution runs across all different devices, again, because the market's changing all the time, and what's right for one person may not be right for another person. So again, flexibility there. In terms of what it actually does, links securely, and again, I know Ken has already mentioned this, that the security is very, very important. Healthcare, you're talking about patient records. Other areas, you'll be talking about other sensitive information as well. So it absolutely must be secure. And we've been through lots and lots of testing with different bodies to make sure that it has been addressed. And then essentially what happens for an example of a district nurse, something like that, is that the appointments and so on are created in the main patient systems within the hospital itself. That appointment information then is sent out from the main patient system to our solution, which is running on an iPad or similar. So that the nurse has their all the information they need, their appointment, who they're seeing, when they're seeing them. They've also got the case history of that patient as well. So they know all the symptoms, all the problems that they've had in the past, access to the notes that other nurses and so on have taken when they've been out seeing the same patient. And in addition to that then, they've got all the electronic forms that they actually need to fill in. Now, I don't know if anybody knows a nurse or anything like that, but our analysis, whenever we start these projects off, nurses can have anything up to 50 or 100 different paper forms to fill in during the course of their working day. It's just horrendous the amount of paperwork that nurses have to cope with. They're meant to be spending time with patients, not processing paper, and really that's what we're addressing whenever we implement our solutions. So the output of all of that, taking all those paper forms out of the process, capturing the information once on the device, they don't need to go back into the office or wherever it is to sit down in front of a computer and type the notes up again. That's all done automatically in the background. So as soon as they finish with that patient, they hit a button, bang, and it's in the main patient record system. And that brings just so many benefits across a whole range of areas. So, you know, things like typically 2 hours a day that nurses are filling in paperwork, processing paperwork, sitting in front of a computer, when really they should be with patients. That translates typically, it depends on the nurse's functions and the roles that they fulfil, that's typically 2 extra visits a day with patients. And that's, you know, transformational. I mean, we're releasing probably a quarter of a nurse's working day to spend giving extra care. Shortening waiting lists, seeing people more frequently, seeing people longer. So it does make a massive difference. And the admin side of things as well, not just on the nurse, but back office staff as well, that's freeing them up to do more things and reduce the paperwork. Because typically what happens is the paper files sit somewhere for a period of time. It could be a day, it could be a week, maybe longer, maybe sitting in somebody's in tray because they've got a massive backlog. In our sort of solution, that information straight into the system. So when a colleague has to treat that patient the next day, they have got access to up-to-date information, not something that's maybe a day or a week out of date as well. So you can imagine the clinical benefits of something like that. To lead in then to a more specific example, this is Bristol Community Healthcare, naturally based in Bristol. So this is, a lot of the time we're always looking for good statistics, good measures of success, and it was great that Bristol took a lot of time and care both before the project but also after the project was implemented. And as you can see here, some quite stark figures. I was personally very surprised to see the changes that the system brought through. So evidence of the care plan, so that this is the treatment that they're giving a patient. They only had records of this 40% of the time for patients on paper. They didn't even have it on the computer system at all at the outset of this project, and now it's 85% of the time there on the whole back office system. You know, I think that's incredibly radical and quite frightening in some respects as well. In terms of things like patient consent, again, we've gone up from 1 in 7 to nearly, 9 out, or just over 9 out of 10 times that they've now got patient consent or records of patient consent. And from a legal liability point of view as well, the trusts and the organisations are quite badly exposed, I suspect, if something was to happen after the event. So again, they're covering themselves from a number of aspects of things. And getting back to the cultural side of things as well here, we're talking about the patients, but also the staff delivering the service. And morale is not particularly high in the health service, as you can imagine. We hear quite often in the press, and I think this one of the last measures that I'm sharing with you in terms of Bristol is actually the staff, how they feel about the system as well. And that we've gone from only half of the people actually think that they're valued and they can do a good job to 9 out of 10 people now believe that they can actually do a good job because they've got the right tools and the right information to deliver the service effectively. And quite often staff are going out and they don't have access to the patient notes or as fully as they want to. So I can imagine arriving with the patient and not being as well informed as you'd want to be. That must be a big challenge for healthcare professionals. The next case study then I'm going to cover is Virgin Care. Virgin Care were awarded a contract to provide community healthcare in Surrey area. Of about the system here is going to grow to about 700 or 800 users, that sort of size. So quite considerable size when you compare it to sort of normal trusts as well. And again, they have measured the before and the after, and all based around our technology and solution. So again, a 30% increase in face-to-face time with patients, so very similar to Bristol. At the end of the day, you're talking about the same healthcare professionals delivering very similar services. And again, they're getting roughly 2 additional visits per day per nurse. That's every day per nurse. To give you an idea, I think Belfast Trust is something in the region of 3,500 community nurses. So imagine being able to give each one of those 3,500 community nurses 2 extra visits a day. Incredible benefit. 60% reduction in processing of paperwork as well. These are healthcare professionals. They want to be treating patients. They want to be spending time with patients. They do not want to be filling in paper forms and sat in front of a VDU typing in, updating patient record systems. That's not what they're best doing, best value getting out of those people. Reduction in the clinical delays, really, to get that information in the system. I've already talked about that earlier. The scheduling time as well. My mother's waiting for a cardiac assessment at the moment, and she's been told it'll be about 2 months before she even gets the letter to actually come and see somebody about that appointment. So getting things processed faster in the system and handled faster in the system, you know, the vital and clinical outputs and benefits that can be had on something like this. And then just the referral handling and scheduling of the work as well. When people are out, and it's a paper-based system, that's something physical that has to be exchanged. If you're working in an electronic world, if something has to happen, and patients might fall ill in the morning and be admitted to hospital, but you've scheduled a nurse to go out and see that person in the afternoon, well, how do you get in contact with them and so on? Again, with our solution, you can update those visits and recall that visit and allocate them on to something else. So again, it allows you to be much more reactive and dynamic in terms of how you handle and optimise your workforce. Finally, just to maybe put some, sort of visually represent what the software looks like. A big part of the impact and the buy-in from the end users, the healthcare professionals as well, is usability and the expectation as well of people using technology now. There's an incredible penetration now of people who have got smartphones. I think we're now up to sort of 60 or 70% of all mobile phone users. It's a smartphone. And, I don't know what the penetration now is in households with tablets, but it's certainly well above 50%. So when people come to work, they expect that same experience of using technology. And traditionally, big enterprise systems are quite clunky and difficult to use and everything else. We have really gone out of our way to make this software as user-friendly as possible, really a consumer feel to operating the software, and completely intuitive. So you don't need weeks and weeks and weeks of training because it's so complex. It's giving the right information to the users in a very, very simple format. And even you'll see things like the ability to capture digital signatures, the ability to take a photograph. So the tissue viability nurse team in Bristol use this. They would take a photograph of a leg wound, and to us that's a bit gory and everything, but it's incredibly useful for them to try and describe a leg wound and then compare it in words a week later versus taking a photograph of it and seeing that visually, and your colleagues carrying out a similar assessment a week later. It can make an incredible difference, even to the stage where you can see you can actually annotate on the photographs and mark up specific areas of interest and so on as well. So just very, very useful. So again, I just want to give you an idea. That's an Android version of it, and that's an iPad version of it on the right there. So again, something simple, easy to use, give people the right tools and technology and information to do their job. And really, that's sort of a conclusion of my presentation case study.
Okay, okay, gentlemen. Thanks very much. It's a very interesting concept, and there's no reason why more of these ideas shouldn't be developed to try and realise savings within the public sector. Can I ask, and I suppose it's one of the usual questions about risk. Obviously there was a number of cases in recent years, and the issue of risk and data security went up the agenda here and also across the water. John, you referred to data security and the cost, and that if you look at areas such as defence, then this has already been put in place. Is there any additional cost? If we were to ensure that such a system was adequately protected, locked down to ensure that there was minimal risk, does that mean there'd be an increased cost?
Well, you probably be better.
It's built into the software, so all of that security is actually embedded into the system itself. The data on the devices is actually encrypted to 256-bit AES, very techy, but it's very, very high levels of encryption, and the traffic between the device and synchronizing back to the main system is also encrypted to the same standards.
The old paradigm would be to put a SIM card in a laptop and give access to a back-end system. So if that laptop were to go missing and somebody were to break into that, that gives you access to all of the back-end systems. So you feel that you're mobile, but they're not secure. But that has been the old paradigm, particularly in health. With the new mobile devices, there's absolutely no connection to the back-end system. It's a push-pull. If anybody were to steal a device, it's physically impossible to access any back-end systems. It's a new way of working. It's completely different from an old way of delivering solutions. So they're actually more secure than a laptop with even a smart card or whatever on it.
But could any system be 100%? proof.
Where there's a will, there's a way.
Yeah.
But it's minimal. The risk is minimal compared to the benefits that mobile working delivers. John's talked about these trusts. From a financial point of view, put it into monetary terms, I'm talking for every 1,000 nurses, an average of £5 million savings every year, which is significant.
You see, in terms of the application itself, I mean, is it something that will be regularly updated with time? Because I suppose the concern that we would have is that, you know, different parts of the public sector would invest in such software, and then you'd find 3 years down the line it's already out of date. So how do you protect against that, and what steps would the private sector be taking to ensure that isn't an issue for those investing?
It's probably the fastest moving part of the IT industry is mobile technology. Generally, technology used to move at the pace of the enterprise. Mobile technology moves at the pace of the consumer, which is probably a refresh rate of about once every 6 months. We have a massive team of developers continually moving the product forward. As new operating systems come out, then we will move our application onto that as well, and we release new versions of the product to take the benefits of that. So we are continually moving on and bringing out new versions of the software. We're in Total Mobile version 5 at the moment. We're already in planning phase for version 6. There's releases in between, you know, sort of major updates as well. So it's an ongoing process, and in this space particularly, absolutely, let's keep moving forward.
In terms then of the local health service, do they, to any great degree, uptake of this kind of technology? And what's your own assessment of that?
There has been interest. We've actually got a pilot with Belfast Trust at the moment. So that's just in the early stages, but that will come sort of into play over the next few months. And we are in discussions with 2 other trusts at the moment, actually, out of the 5 in Northern Ireland. So there has been interest, and for exactly the reasons you've just seen, the benefits are there to be had, and they want to provide a better service, be more efficient, exactly the same reasons.
It has to be said that Northern Ireland, we've been in business for 30 years, tends to lag behind. They're not risk takers. They wait till new technology is developed other places before they jump. Hence, we've been in business 30 years and 90%.
Do we wait until it breaks?
Wait until it breaks. 90% of our business is not in Northern Ireland because of that reason, or else we wouldn't be in business if we didn't go out and do it other places. It sounds a bit critical, but they're not fast moving. You know, don't make decisions quick enough. Worry about things like security too much instead of just doing it and learning as you go. Try to dot every I, cross every T. Sometimes you have to jump with new technology and try it out and get in and do pilots and move quicker.
You know, people are naturally concerned about security, but nobody talks about the paper files that go missing every day. The paper files that are left in the boot of a car, the nurse's car is broken into, stolen. They open the car door, you know, the wind blows all the patient records down the street. That's never reported, never mentioned.
Yeah.
But, you know, somebody loses a laptop and, you know, everything goes crazy in the press. And it's much more secure. So I would argue that, you know, we're not probably aware of how many paper records go missing every day.
Paul?
Thank you very much, and apologise for being late. But I do appreciate that we're maybe not good at embracing new technology in every instance. But I always try to refer it to what would happen in the private sector, and they would be keen to actually drive something forward which was going to give them efficiencies. I'm not talking about savings, I'm talking about efficiencies, so therefore you're making best use of people. And if that can be demonstrated and on pilots, I think that's what needs to be focused in on. But I'm thinking back to something which I did see whenever I was in Germany, and this is not recent, this is probably 5 years ago, in a hospital in Germany where somebody, I'm talking about in a hospital setting as opposed to in a mobile setting, but they make the use of telemetry to a great degree, where each bay has got a pickup. As soon as a nurse, they wear a pickup on their. And as soon as they walk into that bay, it's recorded on a computer. They don't have to write it down. It's recorded on a computer. They walk in. When they take the bloods, it automatically does it. They don't have to actually, you know, when they take temperature and all those readings, They don't have to actually write it on a sheet. It automatically takes that back. Medication can't be given unless it's scanned. And if there, there's all of that, and it's not rocket science. It's fairly straightforward.
Well, your postie has been using mobile technology for probably over 5 or 10 years now. When you sign for special delivery, they hand the device over. So the private sector have been using this mobile technology for quite some time. It is moving fast, and I think sometimes that confuses people as well about what they pick when they jump in. Oh, there's a new better one coming out next month. But then when you wait next month, there's another one coming down 3 months down the line, so when do you go?
You have to go in sometime.
Yeah.
No, the other point being that I'm wondering, the health service itself, in delaying getting some of the patient files into an electronic format, has created its own difficulty as well, and having access to that in a field environment at the home might well be another issue, which should help in doing that, but there has been a delay in trying to get that brought forward. I just wonder, you did mention that you have a pilot, you're running a pilot in Belfast, did you say? How long is that pilot going to run for?
We're sort of just kicked it off over the last month or two, so we're actually just building the solution for Belfast to then sort of roll out to a number of years. So it's early days at the moment.
Okay, that's fine.
Okay, Mitchell?
Yeah, I know what your field of interest and expertise is. Just initially, is health a particularly suitable focus here?
We say anybody that goes, that their main job is to go out and inspect anything, fix anything, have case studies. It's particularly useful for district nursing because there's a lot of paperwork, so it's people in the field. But we have the system being used by gas engineers, plumbers, joiners and housing maintenance, environmental health officers, to anybody in public sector that goes out into the field, and as they're out there recording data that they have to go back to the office to type into the computer, basically as a user for our application. But there are particularly big savings in health.
Yeah, well, I suppose I was thinking about you're meeting individuals, the nurse is meeting an individual, a patient or a client, and it's a one-to-one, so the usual kind of data sharing obstacles and whatever don't occur. I mean, that's a working contract, if you like, and it's delivery of service in a more effective way, as I understand it. And I'm just wondering if other applications in the public sector, because we've been discussing this whole kind of idea of digitising the process, and the big issue that comes up is both security, obviously, storage, and the other one is data sharing. So if you're dealing with health, that may not be the obstacle that it would be in other areas, I suspect. Because you are dealing with, it's between consenting kind of partners here, the patient who needs this support and service and the person delivering it.
It can certainly be used in a very wide range of areas. Actually had a review call yesterday. We've got a project with the Isle of Man government. They're just going live at the moment with their Department of Infrastructure, and a week or two later the Manx Electricity Authority are actually using our solution to do meter readings. They're now looking at bringing it into social care, environmental health, all sorts of areas across the Isle of Man government. So, people are using it in very disparate areas.
Yeah.
It's the same thing. You're going out somewhere, you're collecting information. It's just making that process more efficient.
And then the solution and the pilot you're talking about in Belfast, obviously very important. That will include the data storage facility as well, and reassurance and assurance with whatever necessary backup. Is that supplied by a private sector contractor, or is that part of your in-house?
That's actually our staff in conjunction with the supplier of the main patient record system at Belfast.
So any data that's collected by any mobile system will generally update the back-end system that's already there. So as soon as that's updated, it's available for everybody and shared.
And is that a physical facility or is it a cloud storage system?
We can do both, but I think in Belfast it's on site.
Yeah. So everything's within the control of Belfast Trust.
Yeah.
All the data is in their control.
Okay, and how do you cope with the well-known problem of black spots?
Well, that's the great thing. We've architected this from the very start. In terms of our solution, because this is actually an application that runs on the device, We're not logging in through a web browser and need connectivity. This
Okay,
is
so you're
actually-
living for money, you're safe enough?
Yeah.
Yeah.
Well, as long as you can have connection, could be even at home with your Wi-Fi, to get the visits for the day on your device. Once you leave home, you can work all day long and never connect to the back
Well,
end.
you can back into-
And as soon as
you
you
can back into connection
as soon as you
and it
walk into the
uploads,
connection
yeah.
area, it just pops out and it populates the back end again. So that's one of the big advantages. The users don't have to worry about that connectivity. It's just like your mobile phone. If you've got mobile phone connectivity, this will sync with the back end system. It's one of the key things. It's not just Northern Ireland, everywhere has bad connectivity.
Okay, because we can figure out a way of paying people what we owe them because they're not getting paid. That may be a very good solution to the other aspect of the problem. I think it's an excellent project, and I think it feeds in very positively to this wider discussion. It is very slow, you're correct. And I think everybody recognises the benefits of it, but people appear to be very reluctant just to kind of take the punt. You know.
It's also the cultural
would.
challenges. People love paper. You know, people are, they really. It's a big change in mindset to get people to release paper and everything else. but once you do that, and the benefits that they get, they never want to go back, that's for sure, once they've made this change. And it does allow you to bring in new ways of working as well. So it's not just replicating how things how things work today, how the business process works today. You can do new things and better things as well. So it does allow you to introduce business change.
Most of our projects have always included a transformation manager. It's not just about IT, it's about transforming the business. And most of the savings are coming around transforming the business, not just because we put a bit of technology into their hands. I'd like to say that we were responsible for it all. We're a technology that facilitates change within an organisation. We allow them to do things in the field that they could never do before, but it changes your working practices and it changes your processes. It changes how you go out first thing in the morning and go straight to work, your first job or first visit, instead of going into the office. So there's a whole gamut of areas around mobile working, not just about the technology, but the easier and the better that is, it facilitates quicker returns on investment.
Well, I mean, the technology has been around, and you're kind of this is the applied technology. People will resist change for a whole lot of reasons that have nothing to do with the any kind of knowledge or concerns or vulnerabilities that they see in your process. But what do they say whenever you're trying to convince them that this is the right thing to do in their interest and patients' interest?
You have to get them on board. You have to get them, as part of the team to look at this and win them over as part of the project. Give them the right training, give them the right support, involve them in the project so they feel part of it, so they feel a contributor to it. Whenever they're designing how the system's going to hang together and work, get them on those working parties, and then they feel part of it and they feel they've had everything else.
Our experience so far within the NHS within England has been staff are crying out for it. Literally crying out for it. They're looking for technology. They want to be valued and they want to be given new technology to do their job.
And could you explain just how the pilot has come about? Because presumably it indicates that you were talking to people and some of the procurement officers have responded. Is that what's happening? I mean, is this hopefully going somewhere?
Oh yes. I mean, the idea is if this just proves the point, then it will absolutely be rolled out in a much wider context, and that will be subject to making sure there's sufficient evidence gathered to form a business case that's strong and will support that.
I didn't form that question properly. Is this the department authorising it, or is it a trust that is exploring this? And then you're relying on them to convince people further up the food chain.
I think that's what the issue
That's what
is.
I'm getting at.
Currently, it's an IT project as opposed to a business project, which I believe it needs to be a business project driven.
Should it be policy driven as well? I would think.
Yeah.
There's no doubt we have spoken to the department as well, and we attend NICON and other events too in that sector. So we're certainly very familiar, and there are a lot of conversations around mobile working, a lot of interest. Everybody broadly accepts the benefits that are there to be had. It's just how you go about it, and some people are moving faster than others.
And I think because of the volumes involved, we'll have to bring this up to the issues. Cost. I think people are worried about the cost. This isn't relatively cheap. but the benefits after it's been implemented are quite significant. So I think that initial getting budget has probably been a bit of a barrier as well.
Is this pilot of a sufficient scale, and I know you're only kind of building it now, is it going to be of sufficient size to kind of demonstrate the cost benefits? Because the more micro it is, like the less obvious the savings will be.
Absolutely. It's actually changed a little bit in how we approached the pilot. It was going to be with a couple of very specific teams within the community nursing groups. And now it's been decided what we'll do is do something that sits across all of the users and the numbers that's going to be rolled out, sort of 50, 100, that sort of frame time scale and size. And that's more than enough to prove the economies of scale are there and to get the business metrics that will stand up to the business case.
Okay. Sorry, just one other thing, because it was touched on. Wider applications than health.
Yeah.
How could we inform ourselves of that and how effective they have been as well? Because I presume there are global potentials in this.
We're sort of only talking about ourselves at the minute. I suppose that's our terms of reference, but we have projects in America, in Arkansas, in Kentucky, in Florida. We've got, as I mentioned earlier, gas engineers, we've got plumbers, joiners. We've got environmental health officers, building control officers, social care workers working in children's care, adult care. It's applicable right across the piece. We've developed this to work right across a council for every single worker. Even pest control officers are using it in some councils. Very widely. Our first customers were basically old-fashioned DLO, direct labour organisation, looking after housing maintenance within Edinburgh City Council. 300 operatives going out every day in their vans with their parts to fix boilers and electricity within people's houses. That was the first users, and then it progressed on into more white-collar, more business-like solutions as well. So, it's, as I mentioned, it's anybody that goes out with a clipboard, as well as doing their work, has to record what they're doing.
Yeah, okay, thank you.
Okay.
We've had several conversations like this over the past number of years. And I think it is worth considering how we can start to pull this together again, because it is a bit disjointed, but there appeared at executive level to be a willingness to explore this whole kind of issue of using technological and information handling advances. But it doesn't seem to be a connected up kind of process in itself, even though that's what they're theorising about. And the committee has had several different reports from different aspects of this, and I think maybe we should try and join that together to see just where this project is going, if anywhere. Thank you.
Leslie?
Yeah, I'm sure we'll be doing that. Yes, gentlemen, I find the hospital examples interesting. Just wondering, the example you quoted there of someone with a wound. Have you thought, or do these pilots include, for example, an audio recording at that time? Someone could look, say, at the wound. I think you made the point, looking back on it to refresh your memory, just what the various salient points were. But to actually have an audio recording at that time seems to me would complete the exercise.
Yeah.
Someone could simply have a little device and sort of record it by the end. Job's done, period.
The one small issue with that, which is quite a big issue, is an audio file is quite large. So when you're transmitting that data, it can be expensive and it can also take some time. So the solution can do audio, but sometimes it's the practicality of just the data packet and sending that back and forward. So as that improves, and if we can compress that more, then we would be able to do that.
So it also depended on the particular device that you're using. Apple have a product called Siri, which can interpret your verbal commands and so on. But Siri is actually an online service. So whenever you talk to it, it's talking to computers and then back down again to translate what you're saying.
So you would have security issues around information governance with that, and particularly as the data would be transferring outside of the UK to a server somewhere else, and that wouldn't comply with NHS standards. So we have to not allow that currently until policy change. But physically, it's possible to do that.
Going back to my generation, I used to carry a pocket memo, which I find a very useful thing. Is it possible to maybe have some system whereby that could be downloaded at leisure then?
Could do, yeah. Yes.
You're going to say chalk and slate. But
That's your period, I don't go back that far. Thanks very much.
well, pre-chalk.
Okay, members, any other questions? Keela?
Yeah, thank you, Chair, and apologies for arriving in late for your presentation, but I did read it on the tablet. No, it was very interesting, and I suppose maybe my question would be in terms of just the work that you do and within the health sector and other public bodies, maybe. And I was just thinking when I read it, you know, on the work maybe that the PSNI would be doing. In terms of what they do in the south in terms of text alert and things like that if there's a missing child or something, and how expedient that they can work on that. So I was just wondering, is there do you do work with PSNI around that or other areas, or is there scope for that to include,
Sorry to say,
or is it a security
I've
issue?
been trying for years and I've got nowhere.
Really?
It's funny because part of the conversation I had with the Isle of Man government yesterday was that the police service there
Yeah.
are asking to use this technology. So a road traffic accident, that the police officer could, you know, take out their iPad or
Yeah.
whatever technology, record all of the witness statements, get digital signatures, take photograph of everything,
Yeah.
and back it
I
straight
think,
into
I
the
think
system.
security has been just used as an
Yeah.
excuse, or not an excuse, but as an issue that
Yeah.
just worried too much about it and
But
haven't.
in the wider context, you could catch the culprit or catch the individual a lot quicker maybe with your app.
Yeah, I mean, we did look at the market about 2 or 3 years ago, and I got the sense it was a bit like turkeys voting for Christmas. Your traditional officer goes out, does an 8-hour beat shift, and because they capture everything on paper, they have to come back into the office and spend 2 hours, which is at overtime rates, to process their paperwork. So there wasn't a massive drive or support.
Hours that could be spent at the front line.
Yeah.
They like the 2 hours overtime.
I'm sure that's not necessarily the case. This was
I would say
in English
it's,
forces, but-
it's certainly an area
It
that
can be,
would gain benefits from having mobile working. And they do have their own security issues, and they would have to be looked at individually. The devil's in the detail, but as an area, yes, it's definitely an area that could benefit from gathering data on a technology rather than writing it down.
I have actually heard, I think there was a radio advertisement recently, you know, PSNI were saying they were using smartphones and was allowing their community officers to stay out longer, so
They might be doing something.
Yeah, I saw that too. Yeah. So last week, just.
Yeah.
You know.
But always room for improvement.
They might be doing something, just not with us.
Yes. Okay, thank you. Thanks.
Can I ask, I mean, there does seem to be an issue, and Mitchell's referred to it, about the wider public sector, and you referred to it yourselves in terms of we're always the last to fall into line or to get up to speed with technology. But have you had any engagement with CPD, with Central Procurement Directorate, to ensure they have a full understanding of the benefits of this and
We-
try and mainstream some of
I
the...
think we've presented to most of the departments
yeah.
at some stage over the last 18 months, just to make people aware of what we can do.
You know, we have got around most of the departments. We've worked with some of the folks in Clare House and so on as well, and had some conversations there. So I think, you know, part of the restrictions was certainly up until fairly recently. Northern Ireland Civil Service, the public sector, was restricted to BlackBerry only, and that in itself for mobile working is a bit restrictive in terms of some of the solutions you can actually deploy as well. Whereas now, looking around the table and the variety of devices and operating systems, that's obviously clearly changing quite fast. So again,
Why was it referred, or, you know, restricted to Blackberries only?
They're very secure.
BlackBerry was the only approved device in UK by CSG.
I think because
of the way it worked.
CAA used it.
Yeah.
yeah.
But obviously that changes because BlackBerry as a company have struggled and may not be around in the same guise in a number of years, so you can't have an entire government with a mobile strategy based on this is one of the issues on a technology which is dying. They haven't kept up to date with the newer technology, so it's a bit like the technical police telling you what you can't do, which is it's a wee bit OTT, to be quite honest.
All of Northern Ireland operates at IL3, which is restricted level of security. It can be slightly lower in different areas of other areas of the UK public sector, but at the moment the only approved mobile device for that is actually the BlackBerry, and that's determined by GCHQ, a department within that called CESG.
And see the culture to which you refer, do you sense that that's beginning to thaw now? Or are you concerned that that is still going to be a problem we have to deal with the next couple of years?
It's definitely thawing, maybe not as fast as we would like it as suppliers, but it is thawing. And I think the expectation of the users, the citizens, the patients out there, that whenever a nurse or somebody from road service turns up and they've got bundles of paper and they're sitting with their iPad hooked up to the internet and they've got access to all this technology, but somebody from public sector is sitting there with all this out-of-date technology, there's an expectation. Why aren't you working more efficiently? Why can't you do that? My Sky engineer yesterday did it all on an iPad. Why can't you? So yes,
We have a theory that in a few years' time there won't be such a thing as mobile working. It'll just be working because it would be the norm. These are travelling at tremendous pace where everybody's using them now. And as John mentioned, you want the sort of Sunday night experience that you have at home when you walk in on Monday morning. It's not just public sector here in Northern Ireland, it's quite widespread. I mean, this has only been around since January 2010, but it has revolutionised businesses since, with people writing software for it. So we're still in early days, to be quite honest, but I think attitudes are changing, definitely.
Okay, very interesting. Okay, gentlemen, thank you very much.
okay.
Thank you.
No, I'm fine. Thank you. Yeah.
Okay, members, moving on to the next session. I'm going to refer members to the following documents. The Human Rights Commission letter responding to the CBD response to the Commission's report at pages 30 to 32 of your packs. The DFP response to the Commission's report at pages 33 through to 35. Also, earlier correspondence from the Commission and its report on public procurement and human rights report at pages 36 through to 88 of your packs. So can I welcome to the meeting Mr John Corey, the interim chairperson of the Human Rights Commission, and Ms Kelly Turtle, education worker with the Commission. John, do you want to perhaps open up with some comments and then we'll go to questions?
Yes, Chairman, thank you very much. First, I do wish to record the Human Rights Commission's appreciation to this committee for this opportunity to provide evidence on the report. But before I say anything more, I have to state formally for the record that the Northern Ireland Human Rights Commission provides its advice to this committee pursuant to our role under Section 69(4) of the Northern Ireland Act 1998, and further that the Commission grounds its advice on the full range of internationally accepted human rights standards, including the European Convention on Human Rights, as incorporated by the Human Rights Act 1998 and the treaty obligations of the Council of Europe and United Nations systems. So I have to say that, I'm told. Moving on to...
That's like at the end of the movies where it says, any resemblance to characters living or dead is purely coincidental.
Yes, absolutely. But moving on to our submission, the Commission, as I say, does welcome this positive and I hope positive and early engagement by you in considering this report. We believe as a Commission that this committee has an important role to play on the objectives of this report, which is to embed human rights considerations into the public procurement processes. And indeed, the Commission recognises that this committee has undertaken extensive work on public procurement, and not least the inquiry that you conducted and reported on public procurement in 2010, which I think we consider has been instrumental in the Northern Ireland Executive policy decision to include social clauses in public procurement policy, which are relevant to this consideration. And we think the Commission's report complements and adds to the work that you have already undertaken on this. I just intend, Chairman, to comment on very briefly on just four aspects. First, on the background as to why the Commission undertook this work as part of our overall work on business and human rights. Secondly, a very brief comment on the findings. Thirdly, on the recommendations. And fourthly, and finally, how we might move forward on this issue as the Commission sees it. First, just to set out the background, the starting point really was the decision of the Human Rights Council in 2011 to adopt what are termed the United Nations Guiding Principles on Business and Human Rights, the UNGPs, as they're known in the trade, if I put it that way to you. But the standards contained in these guiding principles are structured according to the framework of the following three pillars. First is the state duty to protect against business-related abuses of human rights. Secondly, the corporate responsibility to respect human rights. And thirdly, the issue of access to remedy for victims of business-related abuses. So that, if you like, was the starting point with the UN developing and publishing and agreeing those guiding principles. Next, the European Union fully committed to the implementation of those UN guiding principles, and that was emphasised in the Commission's strategy on corporate social responsibility, known as CSR. And again, people may be familiar with that. And this European Union strategy included an invitation to all UN member states to produce a national action plan for implementation of the UN guiding principles by the end of 2012. Next, it is the case that the UK government was in fact the first country to publish a national action plan, which was published in September last year, and I have it here. And it unfortunately has remained somewhat below the radar. And if you said to people that the UK government has published an action plan on UN guiding principles on business and human rights, they might be surprised. But the UK was the first country to do so. And so we combine those developments with the fact that public procurement plays such an important role in Northern Ireland's economy and in the life of Northern Ireland, along with the Human Rights Commission's duty to protect and promote the human rights of everyone. Then we considered as a Commission that we had a responsibility to address first the impact of procurement actions on human rights, and secondly, where and how procurement decisions could assist in improving the protection and fulfilment of human rights. So that's what led us to produce this particular report. Secondly, if I could just turn to the report, it provides an analysis of the human rights and procurement legal frameworks, and it details the interactions between those two things and how human rights exist at the interface of those. That's what it sets out to do. Now, I know that sounds complicated language, but it's really trying to address how public procurement interacts with human rights issues and how public procurement could then assist and help in improving the fulfilment of human rights. That's the objective of what we sought to do. And can I just point out, for those who may have spotted it, there is an error in the report. It refers to public procurement in Northern Ireland being 11.5 billion. Essentially, public expenditure in Northern Ireland is circa 11.5 billion. In public procurement, I think the last estimate I saw was 3 billion in terms of the amount of expenditure involved in public procurement. But in terms of the sort of human rights interface with the legal framework and the business side of public procurement, we have identified in the report, and it records there, 3 dimensions to this. There's first of all the state's general responsibility to ensure that the business sector and the third sector, which would also be involved in public procurement, do not violate any person's human rights. Secondly, where a private or third sector body is contracted to provide a public service, the public authority must ensure that that contract is compliant with all human rights laws and standards, as well as ensuring that the subsequent delivery of that contract is human rights compliant. So that's a responsibility that falls on the state as such. And thirdly, the private sector organisations engaged in the public procurement are culpable under human rights law, and so they need to be fully aware of that in entering into any public procurement activity. And that's what essentially the report builds on, those key principles, and seeks to carry that through. And can I also just acknowledge that the research and work on this report was undertaken with the assistance of the Danish Institute of Human Rights, who have been leaders in this field of business and human rights and public procurement and human rights, and continue to do that. If I just comment briefly, Chairman, on the findings and recommendations. If committee members have access to the report, the key findings and recommendations are all summarised at pages 4 and 5 of the report in a 2 or 3 page summary. And so I don't intend to work my way through those in presentation terms. But I suppose the 2 examples emerge from that. The first is that finding is that the current legal and policy framework do not make it clear, explicit and visible, how the state's duties to protect human rights should be operationalised in procurement activities. And secondly, there is also a finding that the current guidance for public authorities on public procurement do not contain any specific references to human rights as such. And then we go on to, in the report, to summarise a number of recommendations arising from that in terms of legal and policy frameworks, guidance and support for implementation, actions that the Northern Ireland Executive should take, recognition in relation to the position of district councils, who are not major players in public procurement at this point in time, but again with a change in district council and local government reorganisation and the greater powers of district councils, that will change, and also a point in relation to accepted and reserved matters. And I think finally, just in opening up the evidence session on this, in terms of the way forward, the Commission acknowledges that it's a relatively thin report. It may not be the easiest to read, but it's a relatively thin report. The report isn't claiming to represent a comprehensive examination of all the issues, but what we were seeking to do was to initiate consideration and discussion of the actions that could be taken. And the report also seeks to outline why government departments and other public authorities should be integrating human rights standards in their public procurement processes. Now, I note the response that you refer to, the response that was received from the department, and you also have a response, I think, in your papers that the Commission submitted to that. I was a little surprised that the department's letter appeared to be defensive, and that I don't think that is necessary, or how we view the position, for 2 reasons. And I think it's important that I state this. First, I want to emphasise it wasn't the purpose of the Human Rights Commission or the purpose of this report to attack or criticise the Northern Ireland Executive or departments. The Commission recognises fully that this is a developing area of human rights work. We're not arguing there's been failure to comply. We're recognising this as a developing area of human rights work. We're trying to break new ground literally, in terms of human rights and this sector of public service activity. And second, can I absolutely say for the record, the Commission has had the fullest support and engagement from the Department's Public Procurement Directorate in this work, in the consideration of the issues, and commitments to continue to work with us, because the Commission recognises that this is sort of set the scene. What we have to do is to try to move forward and progress this, and which requires the development of guidance, development of processes, and the Commission is fully committed to working with the CPD and others who are involved in public procurement to try to do that. And we will engage with departments and public authorities as we see it, to try to embed human rights compliance in public procurement policy and activity. And that's what this is about. So that's all I wish to say, Chairman, and I'd be happy to, and Kelly, to try to answer any questions that people have.
Thank you, John. John, I wonder, just to get members' heads around this, I mean, obviously you're flagging up there's a degree of risk not having these provisions and guidance, etc., in place. But what does this leave us open to? I mean, could you give us some concrete examples, just to get a sense of, you know, is it migrant workers? Is it zero-hour contracts? You know, what are you most concerned about that this lack of guidance could lead to?
Well, Kelly may wish to pick up on some of these points. I think in broad, in a general level, as we see it, the state, in the sense of the Northern Ireland Executive and public authorities, have duties under the human rights laws and standards, and particularly the Human Rights Act, to ensure that all of their activity is compliant with human rights requirements, and that they have done everything possible to avoid any breach of human rights or any violation of human rights. Now, given those absolute requirements, and given that public procurement is such a significant element of public activity, and given public procurement then engages non-state, in the sense actors, in the sense of private companies, third sector bodies, and so on, I think what we are trying to establish and be clear about is that there must be clarity about the human rights obligations that then flow from those procurement arrangements, and the obligations both on the state body that has undertaken the procurement to ensure that the body that they are procuring the service from is fully compliant with human rights, and that those who are receiving the service have their human rights fully respected. Now, that's the sort of overarching principle. Within that, what are the risks, and where can problems arise? Well, problems can arise, for example, if the private sector company or body that the state is procuring from has been found guilty of abuses of human rights, and that is not properly identified in the procurement process or established in the procurement process. And furthermore, the state has the still retains the responsibility for the service provided where there is a violation of human rights. And we're not saying that this has happened, but it will vary according to sector. For example, if the state or a public authority contracts for the provision of residential care for a person, and the person in residential care's human rights are abused, now the state has a responsibility and retains the responsibility for that. So that's one example, and it will vary according to the sector where the procurement takes place. So it's very difficult. It's a wide range of areas of public procurement, and there are a wide range of circumstances where human rights abuses could arise. I'm not sure if Kelly would wish to add to that.
I mean, one of our recommendations is that purchasing activities should be disaggregated by risk, and that's a recognition that there will be some purchasing activity that carries very little human rights risk. But the most obvious one, as John mentioned, would be in the commissioning of services, where particularly you'd have vulnerable people. And that's one where you can see quite clearly there could be human rights engaged around dignity and treatment of people. But there are a range of practices that businesses and voluntary sector organisations could be employing when we're procuring services or goods from them that would connect with employment practices. Some of the issues you raised around forced labour. Work in this area also has looked at supply chain management, so where maybe within the catering industry as well there could be supply chain issues regarding where the ethical purchase of goods for that. And some of the work around human rights in procurement also touches on work that's already carried out and compliance issues that are already carried out around health and safety. There are human rights engaged when considering health and safety. Data protection also, there are human rights engaged there. So it is something that's got quite a broad reach, but we do take a realistic approach to it, and that's why we put that recommendation in about disaggregating with regards to low, medium and high risk areas.
Is there any other jurisdictions that are leading in this respect? Have they covered the bases, or are we lagging behind, is what I'm trying to establish?
I think the positive answer to that is no, Northern Ireland is not lagging behind general practice. As I indicated in my opening remarks, we have been assisted in the production of this report by the Danish Institute of Human Rights, which has been leading in terms of building human rights mechanisms and processes to link human rights with public procurement. And it is the case that this is a developing area of work. We cannot just lift, we cannot, I think at this point in time, lift an example of a country and say that's how it should be done. We recognise that. We are developing new ground in terms of this. And, I have ambitions that Northern Ireland should be leaders in things. And public procurement is such a significant part of our economy and our public service activity. I think it is right that Northern Ireland should try to be ahead of others in terms of application of human rights to that procurement process.
Yeah, we presented this paper in December at the UN Business and Human Rights Forum, where we sat on a panel alongside the Norwegian Public Procurement Agency, who've just recently published a kind of how-to guide. So they're actually as well at the stage of looking at how you do this and providing the kind of guidance that I suppose we have recommended with regards to the guidance note that could be produced by CPD. Also, one thing I think we do need to be conscious of, while we've got a unique opportunity with the UK National Action Plan, specifically referencing a commitment to public procurement to push this forward in Northern Ireland, we also have to be aware that we haven't had the same rate of, for example, commissioning of services to private providers that you'd see in GB, and so for that reason, while we're not behind in terms of this agenda, we may not be aware of issues that could arise further down the line because we don't have, for example, case law here, where there may have been challenges that have been raised in England and Wales on those issues in Scotland.
Mitchell?
Yeah, I'm just wondering, the letter from the department's interesting, and you described it as defensive. But I agree with you. I mean, there has been progress and good progress and a good kind of collaboration across the board between the key stakeholders of the department and CPD. But in their letter they talk about discrimination, and that just I wondered if there is a problem just with the language or the communication between us, because obviously in terms of human rights there has to be a very, very significant range of examples in which human rights itself could be engaged. Not necessarily discrimination, but there used to be in the bad old days, like we used to be told there was no discrimination because it was illegal here. You know, it didn't necessarily mean it didn't exist. But I'm just wondering about that response and whether, in fact, they got the point.
Well, there is, of course, separate guidance which was drawn up by working with the Equality Commission, which addresses issues around the equality and public procurement, and of course quality is part of human rights as well. I just, when I made a comment on the department's letter, I was more thinking of the penultimate substantive paragraph where it says there is no evidence to date that human rights are not being respected within the public procurement process, or that procurement practitioners do not understand their obligations. We're not arguing the opposite. We're not arguing that there is evidence or that they do not understand. We're not arguing that. What we're saying is that that there is scope to improve the public procurement processes that we have to make them fully human rights compliant. And when I say make them fully human rights compliant, that is from the beginning to the end of the public procurement process. It's not just a question of putting a clause in a contract document. It's a question of the whole process being human rights compliant. From the clarity in the assessment of those who are seeking contracts, that they have no record of human rights abuses, that, for example, if there is a supply chain involved, that there's no record of abuse within human rights abuses within that supply chain. Secondly, in the contract itself, that there's clear provision for the public authority to have a continuous process of monitoring for human rights compliance in the delivery of that service. And thirdly, that there is clarity for the person delivering the procured service, that they understand and are practicing human rights compliance in the service that they are providing. And that's what we're trying to develop within this process. I accept it is not easy to visualize at this point in time, because it is still an area of development in human rights terms, and indeed I think the UK's response document and the UN guiding principles themselves recognise that we still have to develop the mechanisms, the precise mechanisms, to ensure that there is this compliance and compliance processes.
Yeah, but I don't. I don't think that people out there actively victimising people or abusing human rights. It can be bad practice. It can be, I suppose, a whole range of kind of influences, and some of the cultural dynamics that we have in our society at the present time have led to some very unfortunate circumstances in terms of, say, ethnic minority groupings. But what we have within the broad kind of public procurement process is a pressure to deliver value for money, to ensure that there's probity and effective protection for the public interest in that regard, rather than like an overriding awareness that there could be inbuilt opportunities or potentials for human rights abuses. So I'm not sure that the practitioners have any malintent whatsoever, but they may not be equipped to recognise the problems or the emergence of potential problems. Yeah. So how do we deal with that? Because it's almost a kind of an esoteric kind of conversation we're having, and then people are going off to do their very busy jobs, and really it must be hard to keep a focus on the possibility of some kind of problem down the line, even though you're spelling out in stark terms that there is a legal implication here if such problems emerge?
Well, there is unquestionably legal obligations in respect of human rights, both human rights that are within the Human Rights Act, which enacts the European Convention, but also in all of the human rights laws and standards that the UK government has signed and ratified. They all bring human rights obligations on the executive, on departments and on public authorities here. And I think what we're trying to present in this report is that in the processes of public procurement, there should be clear mechanisms in place and processes in place to ensure that that whole process is A, human rights compliant, and B, that there are processes within that would prevent, as far as is possible, any risk of human rights abuse or violations.
But is there any
to answer your point,
trail to kind of indicate, for instance, issues that are referred to the Commission, which you judge or agree represent an abuse that has then been drawn attention to the relevant authorities? I mean, does that tell us that there is, it's a bit like gender blindness. People weren't waking up in the morning trying to figure out how they're going to annoy women in our society, but, they're doing it.
Yeah.
Speak for yourself.
Yeah, we accept. We accept. We're not coming here and presenting. Here is an example where human rights has been abused through the public procurement process in Northern Ireland. We're not presenting that case. You could have an argument. For example, 2 years ago, the Human Rights Commission undertook an investigation into residential home care in Northern Ireland. And in that investigation, examples were identified where it could be considered that residents' rights to dignity, human right to dignity and respect, were not being met. And you can extrapolate that then to say that the engagement of that residential home was through public procurement, and therefore there should have been clear mechanisms in place to ensure that that type of human rights abuse or violation could not take place. And that's what we're trying to build. We're not suggesting that we have come with a blueprint that the public bodies are not complying with this blueprint and something must be done about it. What we're saying is that we see this as an area where positive action could be taken to ensure human rights compliance and greater fulfilment of human rights. And we wish to be part and contribute with those public bodies responsible to developing the blueprint to do that. Kelly may be able to speak more knowledgeably about this than I, but the UN has talked about trying to produce due diligence mechanisms in processes, and I'm not sure what stage that has reached.
Yeah, there's. I think when you look at this in the context of the business and human rights broader framework, you can see a lot of work has already been done with the business side of that partnership, if you like, and ideas around human rights due diligence for businesses are very well developed, largely for big multinationals. As you can imagine, the reach of their activities is much broader and they've high reputational risk. But more recently, this has focused on SMEs. I've got with me today even a very recently published guide to human rights for SMEs that the European Commission has published, which is very practical. Some of the issues you raised around how do people know is it just not being aware? This includes, for example, lists of questions that businesses can ask themselves with regards to all their practices, whether that be employment practice, advertising, stress in the workplace, who they sell to, who they buy from. So there's been a lot of practical work done on that side of it. And I think what we're trying to do with this report, as John has already said, is just really review the adequacy of policy and practice here when it comes to purchasing from businesses, to ensure that the reasonable actions that the purchasing authority is required to take to protect human rights are being met.
Thank you. Thank you.
I might just add the point. I referred earlier to the fact that the UK government has produced an action plan last September implementing the UN Guiding Principles on Business and Human Rights. And part of this action plan states that the UK will review the degree to which the activities of UK state-owned, controlled or supported enterprises and of state contracting and purchasing of goods and services are executed with respect for human rights and make recommendations to ensure compliance with the UN Guiding Principles. Now, as we see it in the Commission, this action plan is binding on the Northern Ireland Executive. As well. It's a UK commitment to the UN that this is what the UK will do. So this, if you like, is part of that process of carrying through the UK's action plan. And, whatever, we have used this report in which we have made recommendations, but we recognise that we wish to continue this work with the public procurement bodies responsible and try to develop this further.
In terms of the training that the Commission offers, how long has that been underway?
In terms of the
training?
The introduction to human rights that the Commission's been delivering with the Centre for Applied Learning has been up and running now for 6 months. And we've trained in that time just over 150 civil servants from various departments.
Okay, but in terms of the area of procurement, how many relevant?
We have had procurement personnel come through that training. I don't have exact figures, but that course that we are offering is an introductory course covering human rights in all different contexts. And one of the things that the report recognises is that procurement personnel would require specific training looking at how human rights is engaged in this very complex area of procurement. It's not something that's covered in detail in the introductory course.
In terms of the Central Procurement Directorate, then, what's the most immediate steps and actions that they should take now to address some of these concerns?
Well, as I said, Chairperson, in my opening remarks, Central Procurement Directorate has engaged very positively with the Human Rights Commission on this in the process of launch and indeed at subsequent events. We recognise that one of the steps in the recommendations you will see is requirements for public authorities and business to respect human rights should be fully integrated into general guidance materials and other materials, and we envisage that that the Commission will support and work jointly with Central Procurement Directorate in trying to develop appropriate guidance that meets that recommendation. Central Procurement Directorate, as you know, operates a number of groups that are involved in procurement across each of the sectors, and we would see that as the Central Procurement Directorate as the appropriate place to develop this work, and that would then feed out to other sectors.
Okay, members, any other questions? Kelly?
Yeah, thank you, John, for your presentation. Just listening very carefully, and I think I have to welcome the work that the Commission's doing with CPD. I'm delighted to hear that CPD are very compliant and moving forward with the work that you are doing. I think I don't have a particular question, but sometimes I take issue with the word guidance because it lets a lot of departments off the hook in terms of their definition of guidance, and I see a lot of that within my own work that I do within PAC. So I think, how do you apply guidance and to being mandatory? That's the difficulty. I think that that needs to be looked at. And just in terms of, and I appreciate where you said, John, that we, we're working in terms of trying to be world leaders in this kind of thing, and I would like to see that, as an outcome. But I think if you dig deep, there are perceptions there that human rights have been overlooked in all areas. And as I say, if you dig deep, if you have time, but the perception in terms of the work that we all do does give way to, at times, evidence where human rights has been overlooked in many cases. And that's why I have the difficulty with the word guidance, because it is guidance at times, and not albeit ethically mandatory. So just an observation.
Well, if I may make 3 quick points on that, Chairperson. Whilst I have focused on the development of guidance with CPD as a practical step forward, if you look at the recommendations also include propositions in relating to legal and policy frameworks. And for example, there's a clear recommendation that the Northern Ireland Executive should legislate to make it clear that both human rights, legal obligations and domestic equality laws apply to public procurement, and to establish sanctions to companies responsible for breaches. So, we see a case for setting out a clear legal obligation, that there is no ambiguity about that. We can interpolate at the moment that there is a clear legal obligation by dint of requirement to comply with the Human Rights Act. That does not in any way prevent the Northern Ireland Executive from enacting a law which makes clear provision in a particular area for human rights requirements to be met. I think that's the point we'd make. And the second point I would just make generally, and it goes back to your point, Chairperson, about the training that the training has taken place for civil servants, which the Commission strongly supports and welcomes, and the positive engagement that has been from the civil service for that. Whereas the Commission's task is to hold public authorities, the Northern Ireland Executive and departments, to account for compliance with human rights. And we don't resile from that task, and we seek to carry it out without fear or favour. But we also, as a Commission, believe it is better to work cooperatively and jointly with government departments and the Northern Ireland Executive to create processes and structures where you will guard against any violation of human rights arising. That we think it's better to put as much or indeed a high proportion of our resources in ensuring that what is done in Northern Ireland is human rights compliant in the first instance, rather than following abuses and acting on those. And so that's why we do put a lot of effort into such as the civil service training and extensive engagement with many public bodies in trying to develop human rights compliant activity in what they're doing. And this is what we're doing here.
Can I just mention on the recommendation that John highlighted around legislation that we took as our basis for that paragraph 23 of the Northern Ireland Public Procurement Policy, where a commitment is made there to legislate to remove any ambiguity around, as John mentioned, the domestic equality duty. And so we haven't just sort of brought this to the table without that firm basis where that commitment has been made. The Commissioner saying that should be followed through, and obviously human rights duty should also be legislated for on an equal basis.
No, I value the work that you do in respect to that. Thank you.
Okay.
Thank you, Chair.
Okay, members. All right. Thank you very much for that, John.
Very much. Thank you.
Okay, members, moving on to the next briefing from CPD. Refer members to the preparation sheet and your table of papers and to the relevant documents at pages 98 to 192 of your packs. Can I welcome to the meeting Mr. Des Armstrong, Director of CPD within the Department of Finance and Personnel. You're very welcome. And also Mr. David Carson, the Divisional Director within the Central Procurement Directorate. You're both very welcome. Perhaps if we just go straight to questions, Des, would that be okay?
Yeah, I'm happy enough to take questions, yes.
We're just coming out of a session there with the Human Rights Commission in regard to procurement, which was quite interesting, to say the least. But they have corresponded with the committee to raise a number of concerns. They have, on the other hand, also recognised the CPD has been quite constructive in terms of trying to progress this matter. But some of their findings are concerning. They said that they found an inconsistent level of awareness and knowledge regarding the human rights obligations of public authorities amongst procurement personnel. And also there's a notable absence of any reference to human rights duties in the Public Procurement Policy Handbook and the Procurement Guidance Notes, and there's also a few other constructive criticisms within that correspondence. But from your perspective then, do you recognise this as an area that needs to be developed within the Central Procurement Directorate? And that there's a need to mitigate against any risk in terms of issues like abuse of migrant workers, zero-hour contracts and so on?
Yeah, I think that, I mean, in terms of the very helpful report that was produced, we didn't really get a chance to have a look at input into that, but we're pleased that the report has been published. And we're always willing to take criticism, constructive criticism about how the public procurement process works in Northern Ireland. The criticism seems to be around, the awareness issue, and I think we do need to have a look at the documentation that we have in place and see if that adequately reflects the requirements that are placed on contractors. Obviously, the European human rights sort of requirements are passed across from public bodies onto contractors, when that's applicable, and we need to just look at our documentation to make sure that that's adequately flagged up to suppliers when they're being in a tendering process, or indeed when they're awarding the contract, or when we're actually in contract delivery. So we're happy to have a look at the detail around that. I think there was a suggestion in the report that we bring forward additional legislation to say there's legislation in place, and I'm not sure that's the mode that we tend to move with is administrative action through the procurement guidance notes. And we're always willing to have a look at what we've done on those notes to make sure that they are relevant against any aspect.
Just, in terms of the concerns raised, are there any measures in place at present to check and verify the human rights records of contractors or suppliers, given that you're talking about suppliers from outside the country as well?
Well, the right exists by virtue of the Act that's already in place. So there is already a requirement on contractors when they carry across that responsibility. Our contracts, we tend to try to avoid listing all relevant legislation, because how do you, if you miss an act, then is the contract then covered? I do think we need to look at this particular aspect because it's been brought to our attention and see if we do need to make it more obvious. The report that was produced does reference the action plan that was produced by the UK government, and in that there's a very helpful list listed out the sort of responsibilities or the roles that government, the UK government, would expect from its contractors, and I think that that's something that we could maybe look at to make more obvious to contractors that they will carry this responsibility in terms of human rights when those issues come across as part of the contract. Happy to take a look at that.
Just out of interest, has there ever been any human rights investigations by CPD?
Well, in terms of we look for feedback on terms of contract performance from a number of areas, obviously from clients or from interested parties who may come directly to CPD or to MLS or whatever. We also have two forums in place in terms of the link up with the industry and the construction industry in particular. Now, in the construction industry forum, at times the trade union representatives have raised issues around migrant workers and the pays and conditions, for those workers. And we've been sort of quite clear in working with the Construction Employers Federation, for example, that that type of behaviour is not acceptable. But it has been difficult when those allegations are made for us to get the evidence to allow us to go and make a complete and thorough investigation. Certainly the signals that we're sending out to contractors is that, in Northern Ireland we expect contractors, suppliers to be good, bona fide suppliers, and we expect them to have a particular culture that supports economic development in Northern Ireland and treats people properly as part of that.
And you say there's a difficulty sometimes in getting the evidence to prove those allegations. Does that in itself flag up that there's more work to be done in this area by CPD?
Well, that type of evidence base is something that comes up on a number of areas. For example, on prompt payment or payments being withheld by a contractor. So there is a perception that if an issue is flagged up, that might prevent other business being given, not necessarily in the public sector, but in the private sector if a particular issue is raised. We're always willing to make sure that we put legislation in place where it's required in terms of, for example, the construction order that we put in place on payments, on contracts, or taking feedback directly from organisations and then going off and investigating to get that information.
Okay, members, moving on to questions. Mitchell?
Yeah. Sorry, you Des, good to see you again. We have had correspondence from the Construction Employers Federation and raising concerns about the portal and the tracking system and just how up to date the information is. They actually did give us some examples of it, Has that been brought to your attention? And if it has, did you find their complaints valid?
Yeah, I think the issue around the SD tracking system is one that's been brought to our attention by a number of bodies, including through the Construction Industry Forum. And the purpose of the portal was to give industry information as to where the jobs were and what particular stage they were in the process. And I think it's quite effective if that information is in place. How the information comes onto the system is by virtue of the departments or the particular client that has that in place. What we're doing about it, you may be aware that the Minister of Finance has set up a procurement board subgroup to look at the delivery of infrastructure. And one of the areas that we're looking at is how we can bring information to the construction industry in terms of forward workload, as they call it, the pipeline of projects. And we're drafting some proposals on that, which will go to the procurement board when they meet on the 11th of June. So that.
Okay, well, I'm glad that it's extant. What they were saying is that the portal has failed to be of any particular benefit to the industry because the information in the portal is incomplete and at times unreliable or else lacking in detail. And then they give some examples. Dated the 11th of February this year, showed construction contracts that are pre-procurement. Of the 51 projects listed, only 25 give a date when they were to be in procurement. 31 of the projects listed are schools. Only 20 other projects are listed across all the other departments. Of the 6 DFP projects that are listed, only one has a date for when it will be in procurement, which is the quarter ending September 2015. Seen that? And then only one housing executive contract is listed, and this is due to be in procurement in the quarter ending June 2011. Is there anybody looking at the portal at all?
Well, I think that the criticism is demonstrated by the fact that when you look at the projects, the information is not there. That's not a fault of the system. It's a fault of those who put the information on the system. And what we have to do is do a bit of work to make sure that happens. As I mentioned to you, we are looking at proposals that will strengthen the requirement to put that information in place. When we create these systems, a lot of the fields that are created to gather up information are not mandatory. So therefore, someone who might go on to input information can take the choice, I'm not going to put that data in. We've been working, for example, on the e-tendering system that we're putting in place to make more of those fields mandatory so that we can collect the information that we need as people do their job. The reasons why some of those details are not being put on are probably a mixture of issues, as far as I can understand it, depending on whether commitments are being given or can be given, or commitments have changed, or the presentational issues that might be around some of the projects. But I can tell you that at the moment we are looking at a set of measures that might strengthen the material that's on that.
Why would you have information, Des, that June 2013, September 2013, that's useless to anybody, isn't it? Yeah. Or why would you put on projects that are pre-procurement but don't have a date reference? Because what do you do about that? That's only taking up space, is it not? And who took the time to put information about that on?
Yeah, I think that, apart from that system, there are other dialogues that go on and other information exchanges that go on in terms of projects. There's a regular meeting, for example, with those bodies that are involved in civil engineering, with the Construction Employers Federation, and quite detailed information is given forward in terms of where particular projects are, when they're likely to come. All of that information has to be on the basis, obviously, that things can change. Yes. I think there needs to be information at two levels. There needs to be the high-level information that will be in the tracking system, which the general public are entitled to see. But we also need to sit down with the industry on a more regular basis and say, for example, here's the contracts that we've let in the last 3 months or whatever. Here's the stuff that we have already in procurement. Here's the stuff that looks as though it's going to come into the procurement process at some time, and give that information out more widely to the construction industry as well. I think there's information needed at both levels. But I would accept that, if you look at the current tracking system, accept the criticism that it's not terribly useful.
Well, they're pointing out the problems. Like, obviously, there's useful and relevant information there as well that people can actually get benefit from, and they draw a very wide conclusion that's of no benefit, which I suspect is probably just an expression of frustration more than anything else. But I mean, surely we can deal with the causes of those frustrations. Out-of-date information should just be discarded, or it should be reviewed periodically. Pre-procurement, where dates aren't relevant, is really of no value other than putting people on notice that there is such a project in the current financial year. Yeah. But you're not actually asking anybody to kind of sit up at night and start kind of developing a tender document. But where you have dates, then that is information that means something to people who have responsibility for business and for employing, and so on and so forth.
Well, if we're putting any information into the public domain, it needs to be valid. Would be my view on it. I mean, whether we need it, to back up this with one of our procurement guidance notes that carry some weight. But we're happy to speak about that as well.
Okay, well, hold on, Mr. Nobody, that's me finished. Thanks very much.
Okay. In terms of social clauses, Des, obviously we've received figures for 2012-13, and there seems to be some interesting comparison. When you look at the 2008 to 2012, those figures cannot be separated out. And there's reference to the number of training places, but there's also discussion about training places engaged and training places offered. It's almost like Invest NI language with respect, so it's promoted. I think those figures could be a lot clearer for the committee to look at, but there is a concern that in terms of social clauses, the number engaged, it appears, is beginning to slide. Would that be a fair comment?
Well, I think that in terms of the numbers that we have from the construction COPs, I think those numbers are improving. I think we have some information issues with the, coming from supplies and services. David, do you want to maybe just go through that, back to the information?
I think, Chairman, we're into the second year now of monitoring the uptake of social clauses. And it's clear that when we ask departments for the information, there's not always clarity in what's provided, and the quality of the information coming back and the assurance that we can attach to it is not very high. So that is something that we're actively looking at with departments at the moment. Now that's across all supplies and services and construction contracts. However, on the construction side, as Des said, we have implemented specific measures designed to try and capture the social clauses within those contracts. And those are much more detailed. We're requiring quarterly reports to cover every contract over £30,000. We've just got the returns in for the first quarter of the current year, and the picture that presents is quite positive, and certainly outstrips the figures for 12-13. For example, in terms of training opportunities, we have 78 schemes identified and almost 3,000 weeks of training. 12 schemes with 228 weeks of student placements. And in terms of work experience, there are 83 schemes, and the figure there is 8,500 weeks. Now, what we intend to do is to track those commitments across the life of those contracts, because this really follows on from the Minister's commitments that he made some time ago in relation to the construction area on a number of issues, and social clauses was one of those, prompt payment was another.
I wonder if the committee could have a degree more transparency in regard to the social clauses. Not that you're concealing information, but just if we receive more information on a regular basis. And I think it might have been the Construction Employers Federation suggested the committee be able to do it on social clauses on a quarterly basis. But if we had an overview of where the social clauses are, what department they're in, and an overview of what major contracts are underway, so we can see what contracts are fully engaged in social clauses and which are not. If we had that holistic view, then it would better inform our engagements with the department.
Okay, well, we are intending to bring figures to the Procurement Board in June, which will set out the position in relation to departments, although I think it will also flag up the difficulties that I referred to earlier. But I don't see any problem in letting the committee have that information. In terms of the construction side, we're actually getting that information from centres of procurement expertise, so we can attach a fair degree of assurance to those numbers. We'll also give you that level of detail.
Do you know, just off the top of your head, I mean, the 33 trainees, where would they mainly fall within there?
This was in relation to 12-13.
Yeah.
Those figures haven't been subject to full validation. I have to say there's a fairly significant health warning attached to those. Those just figures came from departments. We haven't drilled down to find out what lies behind those numbers. But from the figures that are now coming forward on the construction contracts, we believe that they could well be understated and maybe quite significantly.
Leslie?
Thanks, Chair. Morning, gentlemen. Just good morning, yeah. Good payment practice. Used to be called prompt payment practice. Any reason for the change?
I don't think so. I think good and prompt would be, maybe they both would be applicable, but that's probably
no, it's not either one, eh?
Drafting, or I suppose maybe. But in terms of payment, proper payment is something that we're really focused on, and we have made very clear on the conditions of contract. That's not only an issue for departments paying the main contractor, but also we want to see proper payment practice within the supply chains.
It's a long-running thing, as you know, Des. In fact, unfortunately, there were a lot of subcontractors were forced out of business.
Yeah.
Where I think the department really took it on board. I'm just a little bit concerned now about, how effective it really is. For example, we have had recently the time taken to approve bills. We were given sort of 10 days as fine, solved it. And we found out actually that in many cases was a long lead time of being the time taken to approve the invoices. Has that been sorted out?
Well, in terms of recognition that we need to make sure that payments are progressed promptly and properly, and the payments then that the process, once those are an agreed invoice, that's paid promptly as well. I think that message is quite clearly out there. In terms of what I can tell you, although we have policy remit, we purchase or are involved in the procurement process for a smaller number of bodies. But I'm quite clear that in my organisation, everybody understands that it's in the interest of economic development and suppliers to make sure that the payment process, whether it's a disputed invoice or not, is cleared up and paid promptly and correctly.
I think that message has been inculcated in the rest of the civil service.
Well, that's the message that we're putting out, and and again, we don't have monitoring arrangements that go across into that. But certainly, the feedback that I've had on the approach taken by CPD directly from industry is that when we ask our project managers or our contract managers to be actively interested in the payment practices of the main contractor and ask for demonstration and information that that's taken place properly, or for any issues to be flagged up about the agreement of invoices, that the processes that CPD have in place they make the system work. The contractors and our systems work on the basis that this is an important issue, needs to be properly addressed. That's the feedback I get directly from the industry.
Right, so being carefully monitored then, what you're saying, Dave?
Yeah, I'm quite clear to my project managers and contract managers that this is the way we want to do business. We want to do business quickly and swiftly with main contractors, and we're expecting them to be in the same sort of mode with their subcontractor.
Project bank accounts, is that an improvement?
It's another lever in terms of that focus and creating that culture where payment moves through the system. There's obviously the additional benefit in terms of what might happen if a liquidation issue arises or administration. There's a bit more issue around that. Having said that, it depends where you sit as to whether you think that's a good thing or not. If you're a contractor, you might feel that his cash flow is going to be impacted by that type of arrangement, and that may not be as good. But what we're doing at the moment is we've taken forward a number of projects on a pilot basis.
In trial, yeah.
And we're looking very carefully, not waiting until that contract is completed, but as we go along, look at what issues might arise on a particular application of that and learn from it. Ideally, we want a situation, I suppose, where the culture is you're paid quickly. If it's a disputed invoice, that's resolved quickly and then it's paid properly. The payment process puts the invoice through quickly. The money flows out into the economy through the main contractors or suppliers, and then that's passed on quickly as well to their suppliers and subcontractors. That's the ideal situation. If bank accounts, project bank accounts become established and are seen by all parties as working effectively, then we can move those forward. Feedback we've had from so far has been positive, but we need to test a few more projects and a few larger projects, and that's why we've agreed with the other COPs that they will each take forward a trial project so that we can test that application and right across the various systems.
Just to show you that we're up to date, we've had a new emerging issue now about the cost of payment.
Right.
Comment on that?
The cost of setting them up?
Yeah, making the payment. And figures in play this morning I listened to in the news.
In terms of the payment process, well, I can't comment on that. That's not in my area.
Just in terms of the project bank accounts, Dave, I mean, some of those must be going for quite a period of time now. Is there any early indicators of how smoothly they're going?
We feel that certainly the smaller pilots that we were taking forward seem to be working okay. And what we'd like to test is them out into the utilities and out to on-roads projects, and those are being sort of set up. We have agreed that we will go back to the construction industry, for example, and give them direct feedback on those projects that we have in place, and that'll happen at the meeting in September, I think. Yeah. So we will be doing a bit of a review through the summer period so that we can have quite an open debate then with the construction industry on telling them this is what we've picked up on our projects. What's the alternative view if there is one?
Okay, Michaela?
Yeah, thank you, Chair, and thank you for your presentation. Just in terms of the rationale for maintaining the existing COPE structures, the committee did recommend that the criteria used in the accreditations of COPEs should take into account the robustness and effectiveness of the systems. That recommendation has been accepted. But just in terms of that, can you tell me where that is at the minute and how that's been implemented around?
In terms of the accreditation process,
yeah.
The accreditation process we have run we have tested the COPES against the accreditation model. That took place earlier this year. The next process for that is that the procurement board will then decide whether the individual bodies retain COPE status. So 3 independent experts were brought in to carry out a gateway review style overview of the submissions that were made by the COPES in terms of that model. So they were presented with quite a detailed set of documentation as to how a particular COPE approached the particular issues in the accreditation model. It's for the procurement board then to decide whether a particular body remains as COPE status or not. In terms of the 2 COPES that are within CPD, we went through the accreditation process with just a few recommendations that we found useful to help us improve. I'm hoping that the procurement board then will retain our status as a COPE when it meets in June. The other bodies I can't talk about because it's within their...
Yeah. Also, just on the standardised reporting across the system, across the public sector, that is going to be implemented now in autumn 2014. I just see in your acceptance of that recommendation, the new system should be available for autumn 2014. Is that on track?
Yeah, that's the new e-tendering system.
Yeah.
Yeah, we have awarded a contract for that system, and that's the intention that all COPES will be operational in the new system by the end of October of this year. Those other public bodies which are currently using e-sourcing will then be brought on after that. So it'll probably be over the period through to end of January that we're hoping to make it available to them, and then any other body which is not currently using electronic procurement, they can come on after that. So we're currently just configuring the system to meet our requirements going forward.
Is there many that will not be using it, that will be moving over?
It's difficult to say. Certainly, there's a number of bodies that tend to be smaller in size. I think the main procurement, the majority of the procurement spending lies either with central government or with the COPES or with the local authorities. And we're hopeful that we can get all the COPES will be using it, and we're hopeful that a substantial proportion, if not all, the local authorities will also use the system. Then we're developing functionality which should make it more attractive to smaller bodies to use it. We've got a particular quick quotes type mechanism for lower value contracts, which will streamline the process for those particular procurements and should take some of the maybe perceived bureaucracy away. So we are hopeful that bodies out there will be encouraged to come on board.
There's a piece of work with SMEs. Is there a specific piece of work with SMEs to encourage them to?
Well, there's a communications program being put in place to inform suppliers that this new system will be coming on stream and what they need to do and to register in the new system. So that will be done on a face-to-face basis, and we'll also be putting out bulletins, regular bulletins. But at this stage, as I say, it's relatively early. We're still configuring the system to meet our requirements. So that will kick in probably during the summer. We will start to warm them up to the new system.
Thank you. Thank you, Chief.
Okay. Peter?
Thank you. Thanks for your evidence so far. So we're going to turn to the issue of, which has been a wee bit of criticism from the CEF on the issue of the balance between getting sort of best value in terms of a tender and simply getting lowest cost. And I suppose their concern is that there's still movement towards lowest cost, which is perhaps understandable in a situation where sort of money is tight. But they're a bit concerned the balance hasn't been got right. I wonder maybe if you could respond to that. And I suppose specifically, I mean, they've made reference, for example, to the recommendations of the use of sort of meat in terms of the most economically advantageous tender, but they're concerned that in terms of the commitment to that, it's all very well in terms of the commitment, but in terms of implementation, that's been quite slow, and that there hasn't been, if you like, an appropriate speed in terms of fully implementing that and getting it dealt with. How would you sort of respond to those criticisms?
Yeah, well, in terms of the position around the balance of quality and price, I think we have been quite clearly pushing meat as the preferred way forward. That causes some issues, though, when you move into low-value procurements, because you then have to require the tenderers to produce quality documentation. And the issue that we discussed with the industry is, at what point does that not add value? If you're looking at a relatively small contract, you want to encourage new entrants into the market, new SMEs to come along. One of the barriers then is, how do they make their pitch and presentation in terms of the quality thing? And we've had feedback that then becomes the essay writing competition. So we spent a fair bit of time in discussion with the construction industry, and we came to a conclusion that above the European threshold, contracts were sizable enough to be able to stand that degree of scrutiny in terms of what a contractor would tell you they can do in terms of providing you with a quality job and their quality experience on that. And then we looked at a graduated approach as we went down the values. We were firmly in a position that we did not want the lowest price, and none of our documentation talks about that. But we did see an opportunity in low-value stuff to go for what we call the lowest acceptable price, i.e. that we would look at the prices submitted and we would not take a price that looked like sub-economic in tendering. So we produced guidance along with the construction industry that actually rules out.
Just in terms of the guidance side of it, I mean, there's some concern again being expressed by them that there's been slippage in terms of timetable of issuing that guidance. That's,
well, I think
it was originally, certainly through the information we have, they indicated they were originally told it would be there at the end of 2013, then March 2014, and in terms of certainly whenever they had last written to us, there wasn't any guidance had been issued. That's it. Where are we with the guidance, and what's the timetable for that to be?
Well, do you want to just?
Well, I think that may relate to the above threshold position, where I think the Construction Employers Federation were concerned that meat would not be applied to above threshold competitions. As a result of putting in the change in approach for below threshold procurements. I think we have recognised that there was a need to clarify that position in the guidance. That has now been done.
Has the guidance been issued then?
Well, the guidance was already there. I think the Construction Employers Federation, their concern was that it wasn't sufficiently specific in relation to the approach to be adopted for above threshold competitions. We have provided that clarification in the existing guidance now. That was done in April, and we agreed the wording with the Construction Employers Federation in advance of that. So,
I mean, it just again, one of the problems seems to be this. It seems to be a wee bit of a communication issue, because if you're saying the guidance was already there, the wording's been agreed and effectively there from April onwards, the indications that we had was that the CEF were writing to us indicating that as of Monday of this week, the guidance wasn't there. So there does seem to be sort of a degree of mismatch.
Maybe we are talking of cross purposes. Maybe they're referring to something else.
We'll certainly check just to find out. I mean, in terms of the first guidance note that we produced in terms of the basis of award on control limits, which changed the business around the lowest acceptable price, was produced in 2012. So we had guidance in place. The issue is that I believe that the construction employers felt that in some sectors they may have used that loose drafting, I suppose you might call it, to allow them to move forward more aggressively on a lowest price basis. But I think that's a specific sector issue, rather than a general issue across the rest of the COPs. But the construction employers were concerned that might be seen then as, if you like, opening the door to this approach being brought forward, but we're quite clear. Above threshold, we believe that the best way to achieve quality construction projects at a good price is by the use of meat.
Okay. Okay, members, any other questions? Probably enough. Okay, Des, David, thank you both very much. Members, moving swiftly on to subordinate legislation. I can refer you to the following proposals: the Land Registry Fees Order NI 2014, pages 196 through to 208 of your packs. I can advise members that a letter from DFP advising on the proposed statutory rule is at pages 193 to 195 of your packs. The purpose of the SR is to prescribe fees to be taken in the Land Registry for the purpose of the Land Registration Act NI 1970. And the rule will be subject to affirmative resolution. So can I welcome the officials to the table. Patricia Montgomery, Director of Registration, Jerry McKenna, Land Registry, DFP, and Michelle Smith, Land Registry, DFP. You're all very welcome. You want to perhaps just give us a brief overview of this, and then we'll see if there's any questions from members.
Okay. Thank you, Chairman. It's a legislative requirement under the Land Registration Act that we fully recover the cost of registration services, and at the moment we are operating under the provisions of the Land Registry Fees Order 11. The current indications are that the revenue in the financial year will not cover the costs for our current services, together with the cost that is required to positionally improve the Land Registry map, and that's to fully accord with the Ordnance Survey base map. The proposals for the new fees order to cover this cost are required as funding isn't available for any other source to enable us to cover the cost of the work to update our maps. We need to update the maps because the legislation requires Land Registry to use the Ordnance Survey map base as our map base, and we then put our layers of registration information on top of the map base. As technology has advanced, the Ordnance Survey techniques have advanced, and they have just completed a 2-year programme to positionally improve all of the Ordnance Survey mapping base for Northern Ireland, so we're slightly behind, and we now need to bring our maps into a coordinated and coincident, make them coincident with the previous editions of the Ordnance Survey map. Our concern, and my concern as the registrar, is that if we don't take the remedial action to reposition the Land Registry boundaries, we will see a dramatic rise in boundary disputes. There will be delays in conveyancing transactions. There will be a loss of customer confidence in the information contained in the register, and I believe it will have a substantial impact on the property market, which is just beginning to struggle back to its feet. The costs of operating the Land Registry are increasing because we have commenced the positional improvement project. We're doing part of it in-house and part of it is doing with an external provider. There has been some growth in the number of transactions received recently, and this year I think Jerry would confirm we just came in on target in relation to our income and our costs. But the fragility of the economy dictates that estimations of what we will raise in fees over the next 2 years are an unknown. We do like to crystal ball gaze, but it doesn't actually work terribly well. We do it as best we can. Based on the current work volumes and the projections of the business growth, it's estimated that the impact of this new fees order will produce sufficient income to cover the operating costs of the registry and the costs of the 2-year positional improvement project. The fixed cost of that project has been spread over 5 years. But in the event that sufficient funds are raised through increased market activity, then the registry has agreed with the provider that we can make full payment of the cost early, and that will enable us then to come back to you with a reduction in fees, which we would be very keen to do. While an increase in fees is never welcomed by customers and isn't welcomed by us either, it is recognised by our customer base that the positional improvement work is necessary to the Land Registry map and must be carried out to ensure that the Land Registry is accurate, is up to date, and that there's good secure title that can be provided to both landowners and lending institutions. The options in relation to the proposed increases have already been discussed and submitted to the Land Registry Rules Committee for their consideration. They have agreed with the preferred option, which was option 3, and that is what the order is based on, and that was our preferred option as well, and that will spread the cost across more of our customer base. And the committee has deemed that the cost increases are fair and equitable and modest.
Just in terms of the third page of your correspondence, it makes reference to an element of cross subsidisation in relation to this work. Could you elaborate on that a wee bit?
We used to, and we do, we have a process for registering charges and cautions and inhibitions. And I've been a little concerned that for some time when we were registering those, when we were taking those off or releasing them, we weren't actually charging the customers a fee for that. And we looked long and hard at that, and we agreed that in actual fact there was an element of cross-subsidisation for other customers because we weren't charging. So we've put in what we believe is quite a modest fee and actually is cheaper than any of our other registry organisations across the UK and Ireland. But we have deemed that £20 is a reasonable fee for doing the release work.
Okay, members, any questions on the charges?
Any question?
Probably enough.
Just in relation to release fees,
Of course.
are we dealing mainly with the covenants that might be on portions of land?
No, that's not us. That goes to the Lands Tribunal.
Okay.
So it's the release of a charge which has been put on the land.
Okay, by a lender or whatever.
Yeah.
Okay, which might well impact on many people now, on the basis that, and you could purchase a property, and as has happened, many people maybe go to auction, purchase a property, and buy it in good faith, not realising that there is a charge against that property, and they take it on with that charge still attached to the property, even though the previous person who owned the property has been declared bankrupt.
Right.
Or whatever, but it's still carried on the charge of the property and not transferred. Now, if due diligence has been done by a good whoever's doing your conveyancing, it should be picked up. But a lot of people feel that they can do their own conveyancing now because it's quite an expensive process going through a solicitor for them just to hand money from one person to another. But we know there's not a motorway going to be built through my house, so I'm okay on that, and I know this, that, and the other. So many people just are willing to take the risk, but unaware. So they can actually go in and providing they can prove that they own the property, and give you proof that, and they can have that removed for a fee of £20.
Well, it would be part and parcel of the conveyancing transaction.
Yeah.
Yeah.
But if they're doing it
Well,
themselves,
with the other land registry fees, yes, you can.
that's fine.
Yeah.
No, that's okay. I'm happy enough with that.
Just, I mean, in terms of impact, has there been any assessment of, likes of solicitors, etc., where this might have an impact? Or?
Yes, we've done an awful lot of liaison with our stakeholder groups, including the Law Society. I've done quite a lot of talks to the Law Society, to the local Solicitors Association. We have been in regular contact with the Law Society Conveyancing Committee, and we've also talked to the lenders, the Council of Mortgage Lenders, some of the building societies, including the Progressive, and we've talked to the Strategic Investment Board, to Invest NI, and to some of the other departments, because our main concern was that actually if we don't have our maps right and the register isn't correct, that lenders wouldn't lend, and that was the main problem for me as the registrar. Was I felt that I was sitting with a register which is not up to date and is therefore leading lenders to be concerned that they would be lending on a property where they weren't sure what the legal title was, because they would have an ordnance survey map. In fact, they actually do have some copies which might help. If I can just... If you just look at the top map, I wasn't sure whether you would want this detailed information or not. But somebody would hold up.
What are you doing with the map of my house?
If I had known, Mr. Mervyn, I could have brought it up of your house. If you just look at that top slide, it'll show you that the red lines show what the land registry legal title is, and the green line is where the PI'd map is now through the new ordnance survey mapping. So what we need to do is we need to actually snap the boundaries there to make sure that they're coincident, because otherwise the lender's going to be saying, do I lend on what's in the red line or do I lend on what's in the green line? And if I'm lending on what's on the red line, does the red line not encroach into the house next door? So,
is this really to do with an overlay then, or an issue with this new digital mapping system that has created the problem here?
it's the ordnance survey map has been completely revised and updated using new positional improvement techniques, and we need to now bring our maps on to what their new boundaries are.
Will this not lead to, because historically in Northern Ireland people have worked with old maps that are maybe, they could be going back hundreds of years,
Yes.
maybe
Yes.
back 100 years.
Yeah.
And on that map there might be a reference point that no longer exists.
Yes.
But they believe they know exactly where that reference point is, and as a consequence, and I've dealt with one, and I think you've dealt with the same one over a piece of just a very small portion of land. We're talking about 1 yard, but because him and his neighbour had a dispute, they pulled out hedges, and he thought it was his hedge, and the neighbour thought it was his hedge. Between the two of them, they ended up in court, and it ended up costing them £100,000 between them. And they never got a resolution to it. You know, a little bit of common sense might have helped. But
That's a real thing.
No. They got certain people in the legal profession involved, and that's where it generated plenty of money for them. But I'm saying, is this not going to create the same issues? Because somebody's going to say, well, I now claim that way has a wee bit of my ground at the back, and I'm using that red line. How can the general public, because some of them will take that as black and white as soon as they get it?
Yeah. That's why it's important to actually move this process forward, because if we leave our maps the way they are at the moment, that's exactly what's going to happen, and we're going to have a massive increase in the number of disputes. If we can snap onto the ordnance survey boundary where we can. If you look at the second slide that I've provided, you'll see...
But can I just, before moving off that, I'm looking at the red line. I could understand if the red line followed in harmony with the green line, but on this one here, it's quite a distance out, and the entrance is quite a bit narrower.
Yeah.
So how can you say that is in any way accurate to what was there previously? Because the green line would be the previous map, and the red line is what you should put in now.
Well, if you actually look, if you do look at the second one, if there is evidence from the deed map that positional improvement wouldn't be correct, then we would be amending in line with what was on the deed map.
Okay, that's fine. Fine, you could agree with that.
Hope I'm doing all right. Michelle is the mapper.
But the problem is that inevitably, where you can resolve an issue for an individual owner, that it's very difficult to do that without impacting on his neighbour.
Absolutely, and that was one of the things that we looked at when we, and Michelle has had to deal with some of these problems at the moment, where we have people, for instance, who live in a small estate of houses, and somebody has wanted to sell, and there's been a difficulty with the map, and we have looked to try and improve that one map. In actual fact, what we have done is we have positionally improved all of those houses in that small development, because you can't improve one house without doing the others, and that's why it's necessary to do a managed programme. One of the options we could have had was that we could have said, let's just leave the maps as they are, and let's just do these on a piecemeal basis as applications come in. But every time we were going to amend one map, we were obviously going to be impacting on the people next door, and that just didn't seem to be a sensible way of doing things. The sensible thing seems to be to actually work through in a managed way and lock out areas of the map in Northern Ireland. Then you deal with that small area, and then you move on to the next one. And we've agreed that programme of work with the Law Society, and they're happy with that. And they will talk to their members about that, and they will be advising their members to talk to customers about that as well.
And has that up to now been a cost-free process?
Moving the maps. Whenever people...
I don't mean the cost of the programme. I'm talking about the rights, adjusting title deeds, registration, property rights and whatever. Is that, can that be a cost-free? It must be.
No, there are people make applications to us to have maps amended, and there is a process for us to do that.
So, I'm not explaining myself. It's if you think that you own a certain amount of property, and it turns out as a result of positional improvements that maybe you don't, and I hope you haven't a windmill built on it or something. You know? How do you handle that? You know.
Well, that's where somebody would write in to me under Section 69 of the Land Registration Act and would say that they believe there's an error in the register, and then we would look at that. And if we believe there is an error in the register, then we would write out to the adjoining owners with a view to trying to get some agreement between them.
Resolution.
And if that doesn't work, then it can go to a hearing in front of the registrar, or it can go to the county court.
So there is an arbitration process.
Yes.
Providing it doesn't go.
It has to be done anyway. It's as simple as that, doesn't it? And but I wish you well.
Can I
see what's ahead?
I don't apologise. I just
They fought wars for less, haven't they? Really?
It's true. Apologise, I was out of the room there for a moment. But coming in maybe like this is a good thing, because it's like something out of Walter Mitty land. One of the things about Northern Ireland was it had this great legacy of good registration.
Yep.
All this seems to be turning on its head to me. Surely the paramount document must be the original lease map. Is that still the case?
Yeah.
So, with this digitisation moving in here, is this going to change that?
No.
You're sure of that?
Yes. Yeah.
That these lines haven't wiggled onto somebody else's land, or
no?
So therefore, lease maps are still.
We always still go back to what the original deed map was. If there's a query, that's where our starting point is. Yeah.
Because your registration should be the same as the lease map.
Should be. Yeah.
Shouldn't it? So, is this? I don't understand then just exactly why we have this problem.
Because the techniques to actually survey have improved to such an extent that when we would look at an old deed map, as you will see the old deed map we have there on the second page, and that's from maybe back in the 20s or 30s, and if you look back at that, the surveying techniques in those days are not as good as they are now, and you will also see that there are very wide red lines. We now are able to give you a much more accurate detail of what that
I understand that. So you're saying it's the width of the line that's the issue then, is it?
It can be, yes.
Is it the only issue?
No, it's not the only issue.
What other issues are there?
Well, there are other issues in relation to how surveying is done now, but I mean, I'm not a surveyor, Mr. Cree, but surveyors are much more accurate, and they are now referencing to real-world events as such, as opposed to just reference points.
Rivers that were now definitely erode away banks.
Yes, I think we're maybe going to have a major problem in days to come.
I sincerely hope we won't have, and PI has been brought in the other registries without too much difficulty, so it really shouldn't cause us a difficulty. There's more difficulty not to do it than there is in doing it.
And not what's the priority, the real world or the positioning?
Do you want to take that one, Michelle, since you're the mapper?
The positional accuracy based on the GPS technology.
As priority?
Yes. Yes, you're saying that there's going to be a problem. In 99% of cases, it's not going to be a problem because most boundaries would have followed the Ordnance Survey boundaries anyway, the field boundaries, etc. They would have surveyed. And the 1%, we will then go back to historic documents, the historical maps, the archives, the legal deed, and take it from there and reference it to the latest Ordnance Survey detail. Like the example here, it will not then coincide with the most
Does that mean you will then arbitrate?
Have to.
Well, what happens when somebody writes in and says there's an error is we look at it and then we approach both parties and we say to them there appears to be an error, and if they will agree then we will shift the boundary.
And if they don't?
And if they don't agree, then they either can come before us and there's a registry hearing, or they can refer the matter to the county court.
Then you've got the scenario that Paul points, it's going to be a nightmare, Joe. Would it not, just as the last question, not have been better to have brought this in with effect from a certain date for all new transactions?
I don't think so, because there's a lot of problems arising currently. We are actually seeing a constant stream of queries from solicitors which have been prompted by the lending institutions as well, because our boundaries are, as in the first example, so obviously offset.
Paul's going to reclaim that hedge that's in the red line later on the night.
Just on that, I appreciate that this. You've already had a look over this. Is it going to show up many anomalies? No.
No, I don't believe so.
So you hope that it's a small number of cases where there will be differences.
Yes.
It should be a very small number of cases.
Yeah, I mean, in the vast majority of cases, we will just be literally snapping to the Ordnance Survey boundary, but there are some cases where we will not be able to do that, and that's exactly why we've shown you that second map.
That would be quite disturbing for me if I was the person that was involved in that, and that was my map.
Yeah.
I would be definitely rattling a few people's heads together. But can you make sure that by your process you're now coming back and telling us that it definitely is not going to be every person's going to be challenged, and we're going to have just a small number?
No, I mean, the Ordnance Survey programme of work was done in relation to the farm grants. And as you know, I mean, their maps have been produced to the farmers, and most of them have been accepted. I don't foresee us having even the same amount of.
But we still have a lot of property sitting out there that's not necessarily it's registration of deeds as opposed to land registry.
Not as much as you would think. I mean, we are moving away from the old registration system, thank goodness, and when we're getting to a proper registration system, and certainly we continue to encourage people to come forward and do even voluntary registrations, because your map is really key.
Are you finding many people doing that voluntarily prior to even trying to sell a property, making sure that they do that?
We're having some, but not as many as I would like.
Because I think of a lot of farms in particular, which have never necessarily, some farmers haven't even registered them because they were part of the Marquess of Donegal estate or whatever that might be, and therefore they were really croft farmers and nothing more than that. But they're under a leasehold, but they've the opportunity to buy it out now and because of the free farm grant and do all that. But if they don't go down that route, and register the land through yourselves, because they've just got a registration of a deed that's been held by a bank somewhere, it's not even logged with yourselves.
Yes.
So there's large areas that seem to be in the rural setting more than probably in towns.
Well, in towns, because of the property boom and the large developments that we got, all those properties are now registered because they were all part of the compulsory first registration exercise. As I say, we would encourage, and I would certainly encourage more people to go for first voluntary registration, and I would be very keen to encourage our public sector
Yeah.
and councils, etc. And in fact, I've just talked to somebody, sorry, slightly off point here, but I've just talked to somebody recently about RPA and properties going to councils and suggesting that this is a very good opportunity for people to now register properties that are in the old registry of deeds system.
Okay.
Sorry, slightly off point there.
Leslie, last question.
Just a quick, another one's occurred to me that concerns me a little bit. One of the difficulties, and this goes back really to local authority, is access to the countryside. A lot of old rights of way, old laneways, railway lines have been incorporated into people's fields and what have you. How the dickens are you going to resolve that one? Bearing in mind they can be up to 20 feet wide.
Yeah. If people have incorporated other parts of land into their own back gardens, then the vast majority of them will make an application for adverse possession.
But the 13 years you're out of it.
Sorry,
It's over 13 years you've had it.
Yeah.
Not
12 years or 30 years against public authority.
So it's not a useful tool. I mean, if I've been farming over that railway track for the last 15 years, I'm sorry, friend, it's mine.
Yeah.
So there's not a problem for you. Just so you sleep well tonight.
Because you'll not be sleeping well tomorrow night. It's coming down the road.
Or the track.
Good luck.
Or the track.
Okay, members, broadly content with proposals from us? Yeah.
Yes.
For the question, the committee has considered the AFP's proposal for subordinate legislation under the Land Registry Fees Order NI 2014 and has no objection to the policy implications of the proposed legislation at this stage. Agreed?
Is that for the real order for PA then?
Okay, thank you very much.
Thank you very much indeed.
It was under
You're very welcome to come and have a look in the registry someday if you would like to, and we'll show you it all.
As soon as you're finished.
We'll be there this afternoon. We're looking for pieces of land to claim.
Moving on, members, LCM on changes in the APD bands in the Finance Bill 2014. Refer members to pages 210 to 220. Advise members that the memo on LCM was laid in Business Office on the 10th of April. The committee must produce a report within 15 working days of that date. Remind members the committee gave initial consideration to the draft last week. No concerns were raised. And advise members the committee will need to go through the report paragraph by paragraph.
212.
Okay, members content with paragraphs 1 through to 8?
Yeah. Yes.
And content with recommendation paragraph 9?
Yes.
And appendices?
Yeah.
Okay. Put the question in the report on the LCM changes in AP air passenger duty. The UK Finance Bill 2014 as amended, as introduced rather, be printed. Agreed?
Yes.
Okay. TypeScript copy will be issued to the Department by the end of the week in line with normal protocol. The report will be published and copies will be issued to all MLAs in advance of the plenary debate. Moving on to correspondence, Shane.
Okay, Chair, there are just draw members to 3 or 4 items of correspondence. Page 222 of the pack, there's correspondence regarding the PSNI civilian staff equal pay grievance, and there's a copy. I think the committee has received correspondence from this person before. There's also a copy of a letter that the Minister had sent back in September, so it's really just to check if the committee want to receive an update, ask the AFP for an update on the Minister's consideration of it's really the moral case for a settlement as opposed to any legal liability, just for an update in terms of that.
Did the Minister not make some comment? It mentioned yesterday on topical questions that his paper has been sent to the executive ministers basically with his proposals to make this payment. So I think if we can, well, initially just check Hansard in that sense, but that's where it's at. So
yes. I believe we just get a formal response from the Department.
I do no harm for the committee to get something back anyway.
Yeah.
If I could just say, I mean, it's obvious from the language, even in the letter, that the Minister is trying to, well, he has to take cognizance of the court ruling.
Yeah.
and the difficulty that creates. And it may be sensible to wait until after the executive have had a look at whatever before we ask, because then it comes into the public domain, and I don't think, you know, that we should be restricting elbow room in this particular set of circumstances. Maybe better let the minister steer it along, you know.
And nothing to harm asking for confirmation what was given to the House.
Yes,
you know, at least we have something formal to the committee that process has started, and it's now with the executive.
I'm only suggesting that if it needs to wait to the executive, then we could wait on coming on the other side of that to get our update, you see.
Yeah, I always like to fight from a position of strength where you declare what you want before you start. Exactly.
Okay. I think he knows exactly what we want. It's one of the few all-party agreements we have in this place.
Well, thank you.
Then, Chair, at page 244, there's correspondence regarding the Presbyterian Mutual Society. It arises from a FOI request from ETI, Department of ETI. It's really more in the remit of the ETI committee, Chair, if this committee is content enough to forward it to that committee for consideration.
Agreed.
Yeah.
Page 253, it's an update from DFP on its performance against saving delivery plan up to 31st of March 2014. Check if the committee want to schedule a briefing, not just in terms of DFP's position, but also at a cross-departmental level. That would inform the committee's forthcoming input to budget 2015-16, if members are content enough to schedule a briefing in the work programme.
Yeah, great.
And then finally, there's an invite from the ETI committee to an energy efficiency event hosted in conjunction with the Green Investment Bank on Tuesday the 20th in the Long Gallery. So it's just members if they want to indicate to staff if they're intending to go along to that.
And is that not the day that taken off? Is it 26th?
It is.
Yeah.
We're not here that day.
We're all Canvassing. Sorry.
So the event's 10th of June.
Sorry, 10th of June? Yeah, sorry.
That's all right.
My apologies. Yeah, the correspondence of pages 14.
We'd still be out celebrating.
14 of table papers, check.
Also, have a
Yep.
we do.
Yeah.
The SDLP would be available.
What about NI21?
That's definitely
Just need confirmation from members before the 23rd.
count me in if I'm available.
That's all the correspondence requiring.
Okay. Draft work programme, pages 272 to 275. Consider members' views on schedule and the following briefings. An update from the Law Commission on its work in relation to DFP and evidence from the lay observer on his role in respect of legal complaints, which will inform the scrutiny of the forthcoming legal complaints and regulation bill. Do you want to try and put a date in for these?
Yeah, we can just schedule them as a work programme when they're available.
Members content enough to schedule those?
Yeah.
Members content work programmes updated reflect agreements made today. Great. AOB. No. Advise members that the next meeting will be the 21st of May. No, next meeting will be the 28th of May, as there's an election on the 21st of May at 10 a.m. in room 30. Agreed.
Okay. Assembly, Committee Room 30.